As a naturopathic doctor, I'm trained in multiple different modalities. Some of my favorites are botanical medicine, which would be the use of herbs. A lot of times I use those just in the form of like chewables or herbs that you would use as tea. Sometimes I actually prescribe tinctures that would come in a bottle like that. I also use homeopathy, and homeopathy is something that initially, I have to tell you, I was really skeptical about it and I didn't even want to learn about it in school. But then I was doing my clinic rotations and I kept seeing these patients get drastically better with homeopathy after they had already been trying lots of other things. So I couldn't ignore it. Ever since then, I have fallen in love with homeopathy and I've seen it have outstanding results, especially in children. It's easy to get them to take, it's affordable, and it works. Another of my favorite modalities is clinical nutrition. I talk about diet with probably every single patient that walks through my door. Somebody always has a tweak that needs to be made, whether it's something we need to remove or something to add, and I love supporting my patients through that process and giving you useful tools to make it realistic and doable in your lives. Another modality I've been trained in is craniosacral. This is one that's kind of less familiar to people, but it's a hands-on form of treatment that's incredibly gentle. It's not like a chiropractic adjustment where we're like doing swift movements to pop and crack. It's gentle movements that's more like soft tissue, sort of like encouraging movement to take place, and the body does so on its own. Really, really great way to encourage the body to heal itself, and also really great with children. Oftentimes, after I do a craniosacral treatment with a child, they fall asleep on the way home because it's so relaxing. Another favorite treatment of mine or modality is counseling. I love to counsel with my patients. I listen, I hear you, and we talk about how we can work through these mental obstacles, because oftentimes mental barriers are some of the greatest barriers to getting better. So I love counseling with my patients.